Hello, and welcome to the Interdental Care video. Today I'm going to discuss types of embrasures, types of interdental aids for types of embrasures, and how we can help maintain your oral health to the best of our ability. So types of embrasures, there are three types of embrasures. Type 1 is an interdental papilla that fills the gingival embrasure. Type 2 is with slight to moderate recession of the interdental papilla, and type 3 is with extensive recession or complete loss of interdental papilla. For each type of embrasure, there's specific interdental aids that are recommended. For example, type 1 dental floss is highly recommended, such as flossers, floss holders, rubber interdental cleaners, soft picks, oral irrigation, and small interdental brushes. For type 2 and 3, interdental brushes are the most effective. Here we have a proxy brush. This is for class 2 and 3 embrasures, and this is what we would call an interdental brush. It has soft nylon tufts and is secured to a wire, of which is secured to the handle of the brush itself. It has small heads, and it is good for ortho, it is good for implants, it is good for splints and space maintainers. Here we're going to be placing it in between the contact area of the teeth. This will help clean out anything that is in between the teeth that is hard, and for those with sensitive gingiva. This is a rubber interdental cleaner. It is a soft pick, and it is for class 1 and 2 embrasures. A soft pick has small elastometric fingers, is effective in biofilm removal and reducing inflammation, and the size of the interdental embrasures determines the choice of the brush. Basically, it's going to be the same as the proxy brush. You're going to put it in between the contact areas in hopes to remove any food debris and biofilm as well. Here we have waxed dental floss. It basically helps floss slide through contact areas easily, it minimizes tissue trauma, and the wax gives strength and durability during application to minimize breakage. You will use your pointer fingers to push the floss up and your thumbs to push the floss down. Here we're going to be working on the mandibular jaw, and you are going to use your thumbs to push it down. So in order to get it into the contact area, you want to saw it down and make sure that you pull the floss out and not pluck it back up, because that will increase risk of tissue damage as well as not getting all of the biofilm and debris. This is called the C technique, and this helps get all around the tooth and into the gums as well. Same goes for molars and premolars. The contact area is shorter between these on these teeth. However, you have to make sure that you still let the floss slide out and not prick it up. This is our unwaxed floss. It is flavorful and thinner. Although it is thinner, this does make it easier to break. But also, due to it being thin, it is helpful with getting into tight contact areas, as well as it avoids snapping through contact areas because of how small it is. Again, using the different finger techniques with the maxillary and mandibular, making sure that you're using your thumbs for the mandibular and using your pointer fingers to use the floss on your maxillary. This is going to be how you floss the distal surface of the most posterior tooth. Although it does not seem like flossing, it is still technically getting that surface of the tooth, even though there's not another tooth on the other side. This is really important because this typically is not where we are known to brush properly. This is the tuft floss, aka the super floss. This is for class 1 and 2 embrasures. It is pre-cut length and has a floss threader. You'll notice about this floss that it has a interesting look to it. It has almost like a fluffy part to it, but this helps catch more debris between the teeth, such as food debris and biofilm. Again, making sure that we are using the saw method where we go back and forth, making sure that we are getting all of the debris and making sure it's nice, squeaky clean. Here I'm going to be demonstrating the crisscross method. This is typically only used with implants and not real teeth just because it is damaging to the gingiva, but with false teeth it isn't harmful. In fact, it benefits the cleanliness of the implant. Basically, you're going to crisscross around the tooth and wrap the floss around and just constantly move the floss back and forth. That way it can clean in between the contact areas. This is a floss holder. The floss holder can be helpful for anyone with a disability, or for a parent or caregiver that is serving a child or client, or an individual that has large hands and is unable to access within their own mouth. It's very straightforward. It's holding the floss for you, so it's still, you can use the C method where you're wrapping it around the tooth and making sure you're still sawing it back and forth to get it in between the contact areas. Again, you don't want to be too aggressive with this, otherwise it can traumatize the gingiva. You want to make sure you're not trying to force anything in because that can harm yourself and you don't want to end up cutting your own gingiva. Here we have a single-use floss pick. Basically, this is what you would see that people typically use day to day. It has a little tiny end that acts like a toothpick almost. It's going to be just like the floss holder. You're just going to saw it in between the contact areas of the teeth. Again, not too hard. You don't want to hurt yourself. These are flavored, and typically this is easier to use for individuals that are unable to get inside their mouth as easy. It is great for kids and adults. It's good for anyone. It is specifically made to make it easier to floss for individuals, to encourage flossing. Next up, we have the platypus floss, which is especially used for those that are undergoing orthodontics, specifically people with braces or retainers and items such like that. With the platypus flosser, the floss gets so close to the teeth of the contact area that it would be able to fit underneath a bar or brace of braces or retainers, just overall making it easier to floss and also encouraging patients to floss on a regular and an easy way. Next up, we have the single tuft brush or end tuft brush. This is also known as the sulca brush, and it is for class 3 braziers. Here we have two different sizes. This is the largest one, and this one has smaller little tufts. It's better to get into smaller areas and between the teeth. When using it, we are going to be putting it in between the contact areas as best as we can, and also brushing it along the edge of the tooth. This way it gets rid of all the biofilm and any food debris that's also there. Again, this is a very easy way that's like brushing but not flossing, that encourages patients to floss in a way and help make sure that their gingiva is healthy. Again, this is the smaller one. This helps with getting right in between the contact areas. As you can see, it is good for individuals that have smaller mouths, like kids, that have smaller teeth, so it's able to get in between those really, really tiny contact areas. Here we have an interdental tip. It is used for class 1 and 2 embrasures. It is a rubber tip stimulator. This is for cleaning debris from the interdental area and is for biofilm removal at and just below the gingival margin. So using this, we're going to be placing it in between the contact areas and then running it along the gingival margin to stimulate gingival blood flow. Here we have a wooden dental cleaner. This is for class 2 and 3 embrasures. It is easy to use, it is easy to transport, and it is ensuring using fulcrum. Basically, for this cleaning, it cleans the proximal tooth surfaces where the tooth surfaces are exposed and interdental gingiva are missing. Space must be adequate, otherwise the gingival tissue can be traumatized. All you do with this is you literally just stick it right in between the contact area, removing any possible debris that's there. This is a disposable or single-use floss pick that is specifically made for kids and just kid-sized for their small teeth. This is a tongue brush. It has bristles on one end and a scraper on the other, so basically you're going to use the bristles to scrub your tongue back and forth. This will loosen up any bacteria, and then you're going to use the other side to scrape it off and then just spit it in the sink. Thank you so much for watching, and remember, your oral health is important, and you are amazing, and you got this.